It's called rhinoplasty, a procedure that can reshape and resize your nose to create a better look. We commonly refer to it as a nose job, but it's an important procedure often performed for medical reasons after someone's been hurt, and then there's also cosmetic reasons.
Yeah, there's a number of reasons why people do it, and feeling confident can be just as important as all the medical reasons. And even though rhinoplasty is fairly common, it can be a complicated procedure, and you need the right doctor.
Yes, Dr. Andrew Campbell from Campbell Facial Plastic Surgery joins us now, along with one of his patients. Her name is Sarah, and is it Jimenez?
Jimenez,
Jimenez,
correct.
okay.
Yep.
Nice to have you both
Thanks
here.
for having me.
Dr. Campbell, that's true, isn't it? That there are a lot of different reasons that people come to you for rhinoplasty. Are most of the reasons cosmetic?
In my practice, I would say about half the patients that I see are cosmetic, and the other half are for functional reasons.
Sarah,
Okay.
what was your reason? Because you were in the before and after pictures that we saw just about a minute ago.
It was cosmetic. I didn't like the appearance of my nose. I had a dorsal bump on the top of my nose, and my nostrils were kind of flared, so it was just purely cosmetic.
And was it something that just always bothered you? Because to me, and probably to other people, they think, oh, you look great, you know, no matter what. But it was bothering
Oh,
you.
yeah.
How was it affecting you?
You know, in school I'd get made fun of, and, you know, that always just stuck with me in the back of my mind. Just, I wasn't happy with the way I looked, so that's when I decided that I wanted to get rhinoplasty.
Now, how old are you now?
I'm 18.
You're 18,
Yep.
so you had the procedure done last year, right, at
Correct.
17. What was the downtime for you? How long were you kind of out of it where you kind of had
To hide.
to hide? Yeah.
About like a week and a half to 2 weeks. I had no bruising, no swelling, which was awesome.
Really? No
Yeah.
bruising and no
Nope.
swelling. Is that unusual, doctor?
I wouldn't call it unusual. I would just say that the average patient will have a small amount of bruising under each eye. It typically takes 5 to 7 days for that to go away. I don't usually see patients with bruising because I see them back at 5 to 7 days to take off their dressing, and I would say 90% of my patients don't have any bruising at that point.
You must be doing a good job then.
I use very small osteotomes, which are what I use to break the bones. So I'm injuring very little tissue and thus creating much smaller, areas of bleeding, and so the bruising is very
Oh, okay.
limited using the techniques that I use.
And I think that's very unique, too, because people have to understand your background and your experience when you're dealing with just the facial region, because you have a lot of experience just as a physician
That's my
before
whole
you
life.
did this. Yeah,
I
it's your
don't do
whole life.
anything outside of the face. So I'm a double board certified facial plastic surgeon. My entire training ever since medical school was in that area. And, rhinoplasty is the most complicated surgery you could possibly do. It is a three-dimensional object that's the most prominent feature on our face, and yet it's supposed to essentially not be noticed. I mean, when you meet somebody, nobody ever says, look at that girl over there, doesn't she have a cute nose? It's not a complimentable feature. You're supposed to look at their eyes, but oftentimes somebody's nasal appearance detracts from their overall appearance so that you notice this nose, and when you go and you fix the nose, it becomes this unnoticeable object, and they start concentrating on their eyes and the other features that are beautiful.
Because they look more beautiful, they're not always sure why. Because I thought it was interesting
Exactly.
with Sarah. She said she got compliments. People would say, oh, you look different. And she'd say, well, maybe my hair's
my
a little
hair.
longer, right?
Right.
Do you feel more confident now with this new look? How has
Yeah.
it changed
I
your
sure
life?
do. I have so much more confidence. My self-esteem has literally increased since my surgery, and I just feel more comfortable with myself now.
And how was your experience with Dr. Campbell?
Well, the whole staff was super friendly. They made me feel comfortable and at ease. They had great assistance, and then I just felt, really happy to work with him because he's such a great doctor.
And how did your parents feel about it? Was it your idea to have this procedure done? And what was that conversation like?
Yeah, it was my idea. I mean, my mom was behind me 100%. I mean, she totally supported me, even my sister and my father. So my whole family was happy that I decided to do that.
Yeah.
And Dr. Campbell, is Sarah on the younger side of your patients? Because
Yeah, she's about as close to getting as young as you'd like to do a rhinoplasty. You want to wait until they stop growing, and she was 17 years old at the time, which most girls have stopped growing by that stage. So she was a younger patient, but certainly well within the normal.
And with boys, is it a little older
A little
than
older.
that?
I like to get them to 17, 18 years old. It really just depends on the patient. If they had an early growth spurt and they've stopped growing and they haven't had any change in height or shoe size in a year, I'll be happy to do the rhinoplasty then.
you talked a little bit about the technique that you use. How do you go about actually creating the nose that somebody wants? I know a lot of people may pick out celebrities and they say, oh, I want a nose just like hers. Is that what you did, Sarah?
No, because it's not realistic. your nose has to be proportional to your face. If you have too small of a nose, you're going to look, you know, weird.
You taught her very well.
Yeah.
That was unplanned. But what I do is, one, I listen to the patient and I try to get an idea of what they don't like about their nose, what they'd like to change. And then I'll do computer-generated imaging so that I can show them on their face a new nose that I would try to create. And I can typically get within a millimeter of what I show them on the screen. So I'm giving them a realistic expectation, and if they tell me, I love that nose, that's exactly what I want, I know I'm going to have a happy patient.
It's like being an artist. Do you feel that most people are realistic about how they want the nose to change, what they expect in terms of the outcome?
Definitely. I mean, if they're not realistic, I'm not going to operate on them. I mean, that's the bottom line.
And that's an interesting point, because I wonder about the conversation. Are there some people who would visit you for some cosmetic changes where you say, you know what, I don't think we should be doing this?
Definitely. It doesn't happen very often, but, you know, there's patients that I think we've all seen on the news and things that have just gone way overboard on procedures to where they look absolutely ridiculous, in my opinion. And if they walk in my door and want more, I'll tell them no. Or if somebody needs wants their nose changed, they've had 3 other rhinoplasties and it's an acceptable result, and they want me to start going in and trying to change that complicated situation, I'll probably tell them it's something they should live with.
Like doing a Michael Jackson?
Yeah, that was a horrible tragedy. I mean, multiple tragedies, one on top of the other, is what created that.
Yeah, and we're talking a lot about cosmetic reasons for having rhinoplasty. What about the medical reasons? What are some symptoms that maybe someone is struggling with right now at home, thinking, I might need to do something?
Yeah, I mean, it's breathing. I mean, we breathe through our nose, and when we're sitting still, you know, we can't breathe and run through, or breathe through our nose and run, but sitting still, we should be able to freely breathe through the nose and not be out of breath. And if they can't do that, or if they're taking in a deep breath through their nose and it collapses and prevents them from taking that deep breath, that's a reason to seek a physician. And
then sometimes will insurance support it and pay on some of it?
Yeah, I mean, I've done pretty much complete reconstructive rhinoplasties through insurance, where I'm taking ear cartilage or rib cartilage and I'm reconstructing a nose because they can't breathe. Or it's been, you know, destroyed either by a skin cancer or by trauma.
That too, injury.
Sure.
Yeah, and this is probably a good time, especially for young people, maybe to have this kind of procedure because it's summer.
Yeah,
right?
And it's time they have time to hide out, and they come back to school, especially if they're going from their senior year in high school to their first year in college. They come to a new setting, new friends, and nobody will ever know that anything's different.
That's so cool.
Dr. Campbell, thank you. Campbell Facial Plastic Surgery is located
in Sheboygan.
In Sheboygan, and you just had the information up on your screen. I was going to look at it and give you the phone number, but it was just up a second ago, so now is the time for this procedure. You said it's the season, right?
It's the rhinoplasty season, summertime.
Okay.
I mean, I do rhinoplasties all year long. I do at least one a week, but summertime's busier than normal.
And great to see a doctor who's that familiar with the procedures, doing that many of them.
Very important to find somebody with a lot of experience, because it's a very complicated procedure and you can regret mistakes.
Dr. Campbell, thanks, and Sarah, you look great.
Yeah,
thanks for joining us.
Sarah, thanks a lot.